Why we always advise that every scan needs to be sent for CBCT read. Once we scroll through the axial section of the scan, you might notice some mucosal thickening in both ethmoid sinuses, the right and left side. We consider that most of the time just mucositis and just a non-significant incidental find. Until we move to the coronal section and we start scrolling again, start seeing this soft tissue mass on the left side of the ethmoid sinus. And you can appreciate the effect on the surrounding structure. So you can see the effect on the medial wall of the left orbit, lamina papyracea, and you can compare it actually with the other side. So you can see that it's thinned and possibly interrupted. Also, you can appreciate the changes that happen here to the medial wall of the maxillary sinus and the inward bowing of the medial wall of the left maxillary sinus. However, if you scroll more and more, you can see that this lesion is involving as well the base of the skull, especially at the area of the olfactory fossa. And if we move more posteriorly, we can appreciate even the changes that happen on the roof of the sphenoid sinus, which causing also slight expansion and also thinning and possibly interruption and communication with the cranial cavity. Unfortunately, CBCT does not provide us with enough soft tissue details, so we usually provide these patients with referral for MRI or medical CT for further investigation, so we can know the nature of that lesion, if it's benign neoplasm, or if it's malignant neoplasm, and if it's originating from the ethmoid sinus, or if it's coming from the cranial base and extending into the ethmoid sinuses. We always say early detection means early diagnosis, early treatment, and better prognosis. And this is why this is a good cause to send your scans to be read by a specialist and to be able to provide your patients with the best care.